For now, let's tell you this other story now. The Health Minister Zweli Mkhize has conceded it might not be possible to vaccinate all the remaining healthcare workers by the end of this week. That's despite his assurances earlier in the week. Over 700,000 healthcare workers still need to get the jab. Phase 1 is now running concurrently with Phase 2, which started this week. eNCA's Heidi Jokos is assessing the rollout at different sites and joins me now for an update from the Discovery headquarters here in Johannesburg. Heidi, while we are talking about, if I'm correct, you'll correct me if I'm wrong, the figure of about 700,000 healthcare workers who still need to get inoculated, we are starting now to think practically about how exactly to roll it out, the vaccine that is, to over 60s and other people in the general population in Phase 2. How does the private sector fit in from the perspective of Discovery?
Yes, sure, Tolas. Before we get into how the private sector fits into the national vaccine rollout plan, what's interesting here is the fact that the health minister said that he hopes, or he set a deadline to have all healthcare workers inoculated by the end of this week, and later on he said it's unrealistic to have all healthcare workers, over 700,000, inoculated by the end of this week. But just looking at the statements from the Department of Health every night when they are sent out about COVID-19 cases, deaths, and also vaccination numbers, we aren't seeing the statistics around how many people have been vaccinated under Phase 1B, which is those that need to be vaccinated that weren't vaccinated under eNCA, healthcare workers and support staff. So it's going to be interesting to see when the department decides to release those numbers so we can get an actual sense of, as of Monday, how many healthcare workers and support staff have been inoculated. But we are at Discovery Health, where there is a vaccination site that's been established here for those 60 and above and healthcare workers. We are joined by the CEO of Discovery Health, Ryan. Thank you so much for your time, Ryan. We really do appreciate it. I think let's just start off with how Phase 1B and Phase 2 has been rolling out here at this Discovery site. I know you've established a second floor to assist those who want to get the vaccine. How have things been going?
Heidi, it's been a really fantastic experience. It's been a fabulous couple of days. We're finding it incredibly uplifting. The people are pouring in here as scheduled by EVDS. Many of them are very anxious. A lot of them are elderly that have been in lockdown for an extended period. They've been socially distancing, and so the relief is almost palpable once they've received the vaccine. We're very proud of our contribution here. We're enjoying the interaction with South African people very much. We're having people from all walks of life come through here, and it's just very exciting.
Just speak to us about how many healthcare workers and support staff you are seeing, because we know that deadline was set by the minister, and later on he said that possibly won't be met because it's over 700,000. Are you seeing more healthcare workers that are getting those vouchers to come and get vaccinated, or would you say there are more the senior citizens and the elderly getting those vouchers?
We vaccinate whoever arrives here with an EVDS voucher and a booking. They must have an EVDS voucher when they arrive in order to get vaccinated. I guess standing and walking around on the floor, the truth is the majority of the people that we see are the elderly, but we do see some young people in amongst them, and they must of course be healthcare workers who are also eligible during this phase. I don't have firm statistics of the proportion between the two. The majority, I would say, are elderly at this stage.
And then just quickly clarify the fact that if you do not have a appointment date and an actual voucher number, you cannot get the vaccine, or do you cater later on in the day for those, perhaps you have certain vaccines left over and you don't want them to go to waste, you cater for those that actually don't have vouchers?
Heidi, we're not taking walk-ins at this site at One Discovery Place. We are trying to deliver a really brilliant experience, and so the best way to do it is to take only scheduled bookings. And so the EVDS system is scheduling people quite reliably. As they arrive for their 2-hour slot, we take them through the process and they are vaccinated. The clear message to the viewers is that if you don't have an EVDS voucher, you should wait for your voucher, your invitation to attend a vaccination site, you should not just walk into the vaccination site.
And just looking around, you can actually see that this is a well-run process. Everything is in place to make sure that those that want to come get the vaccine get it as quickly as possible, and of course are observed afterwards. Are you able to increase capacity, or is that dependent on those who've actually received a voucher, how many people receive the voucher to come to this actual vaccination site, or can you increase your capacity to bring more people in to get vaccinated?
The EVDS system allows us to program the capacity that we can accommodate. Our site has a capability of doing 2,500 vaccinations per day. We're not quite there yet. Today is only day 4. In fact, day 5, and we're building up slowly. And so by next week, I would say we'll probably reach that 2,500 per day. We're also building about another 20 sites around the country. And so together with our partners at Discovery Health, we should ultimately be able to contribute about 40,000 vaccinations a day towards the country's targets.
Do you know when those sites will be available?
We've got 3 more sites that are opening on Monday next week. And then we'll roll out additional sites as and when we can. They do require an accreditation process, and those sites are going through that process right now.
Fantastic. Thanks so much for your time, Ryan. We really do appreciate it. I think that just provides some clarity as to how the private sector is trying to assist as much as possible to get those vaccinations done for phase 1 and phase 2, which we are seeing a number of elderly trickling in to get their vaccines. And of course, as you heard from Discovery Health CEO, that they will be increasing vaccination sites, which is going to be critical as more and more people register and get those vouchers to us.
Yeah, thank you for that. That's eNCA's Heidi Jokos at the Discovery headquarters in Johannesburg. It's an important conversation because we do have a dual system one way or another, right, by default or by design, where we do complement the healthcare system that we have in the public with the private sector, and it doesn't come cheap. And many people will be wanting to know how exactly does that work out when it comes to the issue of vaccination against COVID-19.